But the issue here is that a lot of what RFK says does not make sense to the medical community. I mean, the unfounded conspiracy theories, the false claims about science, well, frankly, all of this.
I do believe that autism does come from vaccines. COVID-19 is targeted to attack Caucasians and black people. The people who are most immune are Ashkenazi Jews and Chinese. COVID was clearly a bioweapons problem. Wi-Fi radiation does all kinds of bad things, including causing cancer. Some of these mass shootings that we're seeing in this country may be related to these new class of drugs, of SSRIs and benzos.
Now, to be absolutely clear, there's no evidence of any of what he's described, but it's got the medical community worried, perhaps for that very reason. Because if RFK gets confirmed, he will oversee the 13 agencies under the HHS, from the CDC to the NIH, the FDA, the Centers for Medicare and Medicaid. Now, look, you heard a lot about this, but no one person is one-dimensional, and that obviously includes RFK Jr. He's gained a lot of support, frankly, for saying that he wants to cut corporate influence in healthcare, which might explain why vaccine makers are also freaking out. You know, their stocks actually tumbled after the RFK announcement. He also says that he wants to improve our food by getting rid of chemicals and also additives. And he wants to make Americans healthier, he says, by combating chronic disease. The thing is, he's got no experience running a vast government department. But for that matter, neither does Pete Hegseth or Tulsi Gabbard or Matt Gaetz. Trump wants all of them, though, to break down the bureaucracy that they're being asked to run. Which gets me to another saying: don't let your mouth write a check that you can't actually cash. Will Trump be able to do that? Senate Republicans are going to need to confirm these very provocative picks, although some more so than others. And Trump is all but telling those Republicans, go against me if you dare. Joining me now, Democratic Governor of Hawaii, Josh Green. He's also a physician. Also here with us, epidemiologist and director of the Center for Infectious Disease Research and Policy at the University of Minnesota, Michael Osterholm. Thank you all for being here. Let me begin with you, Governor. Governor Green, you have pretty strong feelings about RFK Jr. as HHS Secretary, particularly after an experience you say you had with a measles outbreak. What happened?
Yeah, well, thank you for having me. We had a terrible experience in Samoa. RFK went and rallied that country against vaccinations when there was a measles outbreak. It resulted in the deaths of 83 innocent children. You see pictures of me vaccinating people there. Basically, what he did is he scared that country away from vaccinations. And measles will kill young people. It caused 5,000 additional cases. And I actually was contacted by the Prime Minister of Samoa to come in with a contingent of medical mission workers from my state, from Hawaii, to go and vaccinate people. And we vaccinated 36,997 people to basically stop the measles. But it was too late for 83 children. We went into one village and a child had just died and was still warm. And then we had a funeral service for that child because they died of the measles, and then vaccinated their 7 or 8 other siblings. And then we went to the next village. That's what RFK did. And if he is confirmed as HHS Secretary, what he will do is he will cast doubt on vaccination programs across America. That will mean thousands and then millions of people will consider not getting vaccinated. We will not have herd immunity. And physicians like myself and pediatricians and all sorts of other healthcare providers will see cataclysmic spread of disease. So he is the worst possible choice for HHS, and I hope that the president will pull his name back.
We'll see what the Senate says. I should say that RFK Jr., Governor, said that he, quote, had nothing to do with people not vaccinating in Samoa, and he never told people not to vaccinate, unquote. I know that you have a very different experience, but he has denied those allegations. I do want to bring in Michael in this instance because RFK Jr. has said that no vaccines are safe and effective. He also said that I'm not going to take away anybody's vaccine, trying to reconcile the two perhaps would be head spinning. But here's what Trump's transition co-chair, Howard Lutnick, says Kennedy really wants. It's
he
online.
wants the data so he can say these things are unsafe. He says, if you give me the data, all I want is the data, and I'll take on the data and show that it's not safe. And then if you pull the product liability, the companies will yank these vaccines right off of the market. Let's give him the data. I think it'd be pretty cool to give him the data. Let's see what he comes up with.
Okay.
I think it's pretty fun.
Pretty fun. Well, people may hear, all right, let them look at the data. Is there any harm in doing that?
Well, first of all, let me just be really clear. The data that he's talking about is unclear to all of us, because the data that you need to use to assess the safety of these vaccines actually is already in the public domain. It's not something that you have to request or to take a look at. And this has been one of the problems with Mr. Kennedy's approach to what we call science, in his words, is the fact that he consistently mixes up messages, he mixes up different disease problems, and trying to follow him and understand what he's talking about is often like trying to nail Jello to the wall. And so that's one of the challenges. We can't have that kind of science. You can't agree on Mondays, Wednesdays, and Fridays that gravity works, but on Tuesdays and Thursdays it doesn't. And that's one of the real challenges in trying to direct response back to the kinds of comments he makes.
Saying, let me see the data, does imply that it's not readily accessible, which might surprise a lot of people as you're saying that it's publicly available. Well, Governor, let me go back to you, because a fellow governor, Jared Polis, said that he was excited, his words, excited by the pick, and that while he's not into banning vaccines, he actually praised RFK for wanting to take on big pharma, for wanting to make food healthier and regulating pesticides. What do you say to those who think RFK Jr. could do some good?
Well, first of all, I was with Jared today throughout the day at the Governors Association meeting. We talked about this. Jared is very worried about what RFK would do over vaccinations. Whether or not RFK gets to do anything else, who knows? But this is a gentleman who has absolutely no training in public health, no experience in public health, nor does he have any experience in biopharmacologic processes either. He is a quack scientist. It is obvious. And Mr. Trump is doing this to be provocative. Now, tearing down government when children's health is on the line is not okay. I was disappointed in Jared, who I love, who is one of my favorite governors, but it is not okay. It's not okay to do what he did, to cast doubt on processes that are well established in science. It makes parents scared. When parents are scared, they don't take action. If people freeze and we lose 10 or 20% of our vaccination rates, you'll see disease spread widely across America. And remember, you've got a lot of children who are too young to be vaccinated who will be very vulnerable when these diseases spread. You'll see some polio come back. You'll certainly see outbreaks of measles and mumps and chickenpox. All of these things don't just sometimes kill you, they also will cause serious neurologic damage when children are ending up with infections because they couldn't get immunity. So look, there's going to be different opinions. I'm the only physician governor in the country. I actually had to cross paths with RFK. He has now lied about what he did in Samoa, where he discouraged those individuals from getting vaccinated. And it's very dangerous. We've seen a lot of this kind of misinformation from the Trump universe on many levels. But this is our children's health. This is not a political thing. This is not Democrat or Republican. This is your kids. And so when Republicans go to vote, I pray that they will not allow this gentleman to be confirmed.
What you described is so daunting as a mother and obviously a person in this country thinking about the ramifications and just knowing the vaccination process that you go through with your children to go to school and beyond. It's very terrifying, frankly, Michael, to think about what he's described. If you were advising senators for his confirmation hearing, what kind of questioning would you encourage them to focus on?
Well, first of all, we have to recognize the seriousness of the situation. The governor, I think, has done a great job of laying that out. But let me just add one figure to the mix here. We estimate with some really very detailed studies that in the past 50 years of vaccines being available for young children, we've saved over 124 million lives. That is 6 lives for every minute for the last 50 years. So if I were a senator asking questions, I'd want to know exactly what data are you citing to say these vaccines aren't safe? What data are you citing to imply that it's a health problem that's being caused by things other than vaccines. And I think the challenge we have right now is basically making sure that people don't walk away with what he purports to be facts versus what are the real science facts.
A really important conversation and a really important moment for our nation. Governor Josh Green, Michael Osterholm, thank you both so much for joining.